Firstly, I'll do a quick introduction. So, my name's Andy Mackarti. I work for... Better? I'm a Principal Advisor Health and Hygiene at Oюу Толгой, so I work in Patrick's team. I've been here close to 2 years, loving every minute of it so far, and previous to this, I spent about 12 years in the Australian mining and oil and gas industry in health, hygiene and medical positions around the country. I hold postgraduate degrees in occupational hygiene, safety and toxicology, and I'll graduate from the Mongolian National University of Medical Science this year with a Master of Public Health, which I'm really looking forward to. So I'm a fairly passionate and driven health and safety person, and I really hope this talk will shine that through. So this is our overarching OT health strategy. So this encompasses occupational hygiene, occupational health, health and wellness and medical. So there are our 4 pillars that we look at OT. Underneath each of those pillars are the things that we commit to for our people at work. So OT has a range of health, medical and wellness initiatives that are currently in place. And we have many more planned for the future. So they're designed to ensure our workforce is in the best health that they can be in. So we do more than just look after our people on site though. So OT health extends beyond the OT site to Ulaanbaatar, our neighbours in Hanbod, Dalangzadad and the rest of the South Gobi. So what we're trying to do is improve the health of all Mongolians, not just the ones that work for OT. So the following slides will provide a brief description of what we do and how we share our knowledge and experience. But before I start, I'd just like to say thank you for inviting me to talk here. It's a real honour to be up here. I'd like to thank the organisers, the delegates, the stallholders, and of course the translators. Without the translators, we wouldn't know what's going on. So the lady that's been talking in my ear today has done a fantastic job. I really enjoyed this morning hearing people talk about health as well as safety. Sometimes health is left behind and safety is the focus, so I quite enjoyed that. It was also great to see some colleagues, Naransuk and Boldmar, who are champions of occupational health and hygiene in Mongolia, out there in the stallholder area, so please visit them while you're there. I've also ran into some new colleagues that I recently met from Erdenet, and it's great to start striking up new relationships. So improving the medical services in Mongolia has been a real primary focus for myself and my team since I got here. So the OT health and medical team joined forces with 3 Ulaanbaatar-based hospitals.
And excuse me, a little bit slowly, please.
Sorry.
Maybe translate it to typical.
My apologies. So the health and medical team joined with 3 hospitals in Ulaanbaatar to help improve the quality of our pre-employment and periodic medicals. So this has been a paradigm shift in quality and has taken us around about 12 months to achieve. The process involved training, mentoring, auditing and assisting each of the hospitals and their staff members to increase their quality up to international standards, which is what we need as a Rio Tinto company. So we're currently going through the process with the Hanbod Hospital, and I really hope to have medicals in place there by the end of this year, maybe early next year, and we'll start working with the Dalangzadad Hospital next year. So the new system not only has it improved compliance for OT standards, it's had much wider implications and will continue to have much wider implications. So as we're using external providers now for our medicals, we're putting funds through the door of hospitals which can use that for upkeep of the hospitals, for employing new staff and making sure we have the right specialists in place. So our emergency medical assistance obviously extends wider than just the OT site. So far the OT clinic on site has seen 65 patients from the South Gobi community with a range of illnesses or injuries that the local hospitals couldn't deal with or needed some help to deal with. So these presentations are anything from a simple X-ray to serious multiple trauma from vehicle accidents. We're proud to say that we've never turned away a person from our front gate that we can't help. In 2019 so far, we've arranged and supported 3 emergency aircraft evacuations for critically ill South Gobi people who needed some serious medical attention that the local hospitals couldn't give and we couldn't give on site. Another partnership that OT has become involved in is promoting women and youth health around the South Gobi. So we're a proud partner of the Integrated Health Program, which is a partnership of many organisations that you'll see in the top corner there. So the program has 6 main outcomes for youth and women around the area. So it's increased coverage and improved quality of sexual and reproductive health services for women, adolescents and youth. A reduced incidence of STIs and cervical cancer, detection and treatment of non-communicable disease, including cervical cancer and road traffic injuries, sub-national level governance and capacity strengthening, adolescent and youth empowered to participate in youth forums to assist with decision-making or policy decision-making, and gender-based violence and domestic violence prevention and strengthen responses to that. So we're a very proud partner of that. Continuing on, one of the programs that was sponsored under this Women and Youth Health partnership was training in KB and DZ on women's cancer prevention and emergency patient management. So we had 5 Mongolian doctors and 6 Australian doctors come and attend these local regions and conducted training for 24 medical professionals at the KB hospital. And that training was on emergency management of patients who needed critical care. While they were there, we also organised training for adolescents and youth on hygiene and reproductive health. During that training, 160 young people attended and learnt about reproductive health. And while we were there, 117 of those youth had screenings for STIs and meetings with specialists to discuss their general health. So another thing that we're very much interested in is capacity building of our local hospitals and our local people. So mobile technology to identify and diagnose many illnesses and disease has been deployed throughout the Intersum Hospital to provide services and support to our local herder community. So we'll take this equipment out into the field with medical professionals and meet our herders at their GER in their own area, so they don't have to come all the way to the hospital. A memorandum of understanding has also been signed between for a regional and diagnostic and treatment centre in South Gobi and Echuca Hospital in Melbourne. So the gentleman on the screen there is the hospital manager from Echuca. He was brought over by the Australian government to sign, to meet the people of the KB hospital, sign an understanding that we'll help them get them to where they need to be. If I can just go back. Well, one of the other things we've done for hospital management is Alton Bayer, who was our clinic manager for going on 5 years at OT, was recently awarded an OT scholarship, and we've sent him to Perth to study hospital management. So when Alton Bayer returns to Mongolia, he'll be coming to run a local hospital for us. So the OT Health team is partnering with the KB Hospital to deliver occupational health services. So these are our pre-employment and periodic medical checks, which I mentioned before. We want this in place for our South Gobi population so they don't have to come to Ulaanbaatar or onto site to have their medical checks. So we've committed to training, mentoring and quality auditing all of the staff involved in this project, and our target date is January next year. And we are waiting on some equipment, so hopefully we can get there. To help with this, OT have donated laboratory biochemical testing tools and transportation equipment for injured persons. So when we are transporting ill patients, we've got the right stretchers and things to pick them up and bring them to our airport. One of our contractors, Maxim, who look after our explosives, they donated surgery equipment and tools worth 20 million tugriks to this hospital as well. So we're doing great things with building their capacity and making sure they've got the equipment to do what they need to do. And final slide, we also donate and vaccinate our South Gobi population against influenza. So we're coming into that season now, and we're in the process of organising our vaccinations to be brought into the country. So last year alone we donated diagnostic equipment and medical equipment to 15 hospitals and the DZ family clinics. And this promotion also involved the donation of 1,370 flu vaccinations for our local population. OT is also funding the build of a 10-bed health centre in Mandal Uvo Sum, which is another great thing for us. We have employees that live in these sums, so we want to make sure that the medical care's there when they're at home, not only when they're at work. So mine's a pretty quick talk, but thank you very much for your time.